Hello, I'm Dr. Sujatha. I'm one of the pediatricians and pediatric intensivists based at Aster RV Hospital in JP Nagar. So, why do children get vomiting and loose stools? Commonest things is viral infections and followed by probably related to food or travel. If it is a viral infection, generally children have a little bit of low-grade fever. Now, the first presentation is usually with vomiting. So, you find that the child may just bring out the food that they have consumed. Sometimes they just bring out the water, and very rarely, and if it's a serious thing, then if your child brings out which is greenish in color, that is a serious vomiting. That needs immediate attention. So when the child gets stools that are much more watery than what they normally produce, then it is called loose stools or diarrhea. Now, majority of the time it is brownish or yellowish in color. Sometimes you may see blood or what looks like mucus in the stools. If it is blood or mucus, we always take it seriously. We would like you to visit the pediatrician at that point. A child can have loose stools about 5 to 6 times in a day, and majority of the times children can manage with their own selves by simple methods such as oral rehydration. So the first thing is to stop the vomiting so we can give the hydration properly for the child. If the child is passing loose stools after taking some feeds or fluids, that is quite acceptable. It is something we routinely observe. It doesn't mean that whatever the child is taking is just coming out right away. That is not the case, because it takes at least 4 to 6 hours for the food to get digested to reach to the bottom end. So there is nothing to worry. So diarrhea this loose stools or diarrhea can last for up to 2 weeks. Majority of the times it settles down within 4 to 5 days. So when I talk about gastroenteritis to parents, I want you to remember a few things. Vomiting, we need to make sure that it is not happening for more than a couple of times, and you can think about giving medications to stop that so that you can continue the hydration. If your child is having loose stools more than 6 times in a day, then you can think about making sure that the child is adequately hydrated. So you can give something like a rice kanji, which you can prepare at home. You can give oral rehydration with not just plain water, but with a little bit of a pinch of salt and some sugar in it. Either you can make it homemade or you can take the commercially available ORS. It's always a good idea to have a pre-prepared ORS available so that you can give it immediately to the child. It is available in different flavors, so it is more palatable for the child. In terms of loose stools, we won't go just by the number of times the child is passing loose stools. It is more to do with what quantity comes out and with what pace you are able to rehydrate. That's what defines the hydration status. Now, how do you recognize whether your child is dehydrated or not? So one of the things that you can look for is your child's activity. If your child is very active and running around and is passing urine well, feels normally thirsty and is able to accept the fluids that you are able to give him or her, then your child is probably well hydrated. If your child is less active, if your child is passing less urine and is feeling more tired, it's a good idea to get your pediatrician to see the child to look for signs of dehydration. It's always important that whenever you're caring for a child with vomiting and loose stools, you maintain good hand hygiene. So whenever you are cleaning the child, make sure that you wash your hands and you safely dispose the diapers. It's important that before you feed the child, you use clean containers and make sure that everything is sterilized properly and you wash your hands. So washing hands when feeding, washing hands after feeding, washing hands after disposing the diapers or cleaning the child's bum. So it's absolutely important that the cycle of contamination is broken up front. In terms of treatment, we normally do not recommend any medications apart from good hydration. That's all we suggest. If you're worried about your child, you can always visit your pediatrician. One of the myths that I find that parents have is, should we be giving milk? Should we dilute the milk? Should we, avoid milk altogether? So those are basically myths. We don't recommend you to stop it right away. You can go ahead and give it in the form of buttermilk. And just because you give the buttermilk, your child is not going to get any increased incidence of cold, cough or anything because of this. Neither will your child get fever because of the diet. It's a part of the illness and the child usually settles with supportive treatment. I'm flashing up some signs which I want you to recognize, so that when you see these red flag signs, I want you to visit our hospital or any hospital so that your pediatrician can assess your child. We are available at Aster RV round the clock with trained pediatricians available to assess your child. Thank you.